to a topic we all know very well, healthcare, that is. China is attempting to court foreign players to its healthcare sector and promises a less regimented system in a bid to cater to its burgeoning demand for Medicare. China is the world's most populous nation and is now struggling with a rapidly growing aging population. One company to take up that call is U.S. firm Cook Medical, one of the world's top private medical gear maker. Talk more about the company's plans in China. Barry Thomas, VP and Director of Asia Pacific at Cook Medical, joins us, of course, still with us. Lucas Filippo, our guest host. Very good to have you with us. Tell us, what exactly is it that you make that is allowing you to bet on this huge growth potential here in Asia?
Well, we're a very diverse company and we have products across a broad range from aortic intervention to peripheral intervention, urology, endoscopy, and we've been in business since 1963. So we have a very broad range from basic healthcare right through to the most exotic products that are available in the market today.
We know that China, of course, is opening its doors, its healthcare sector, to foreign direct investment. What opportunities do you see there? And how exactly do you penetrate a market like China where rules keep changing all the time?
I think the secret to China is embracing the market and understanding what's going on there and being flexible and adaptable so that you can look at the opportunities that come along and then move with them. It's not a market that you can go into and dictate how you want to do business. I think that's the secret that we've done.
What opportunities, what trends do you see in China? Give us an example, for instance.
Well, there's an aging population there, and of course the younger people are working more. So whilst the younger people are working, their families are being cared for by the elder people, and so they want them to have a better health care and be well longer and be able to provide that support for the family. So the younger people are encouraging the older people to improve their healthcare lot, and I think that's a great opportunity for us as well. So I think it's those things that are really driving the healthcare. There's about 300 million people now with access to healthcare in our type of healthcare in China, and that will expand.
I have a question. Speaking with Chinese officials, you get the impression that those guys want to learn everything and they want to be able to produce everything 10 years or 15 years from now. So speaking off the records as much as it is possible, what is your feeling about that? Do you get this feeling by Chinese that they open the market in order to learn how to do things and then being able in a near or farther future to produce them themselves?
I think that's part of the challenge of doing business in a country like China, and hence my comment about embracing the market. We want to be part of that. I think if you fear it and you try and manage it and manipulate it, you will suffer. I think what we've got to do is realise, yes, that's where they want to be, but let's be part of that. Let's not fight it.
Barry, it's Bertha here in the U.S. You know, when we look at Chinese spending on pharmaceuticals, 40% of their healthcare spending is on pharmaceuticals. It's a lot higher than more developed countries. But at the same time, they are haggling with big pharma right now to cut prices. When you enter China in whatever market, whether it's pharma, devices, or something, do you worry about having to cut prices? Because even though they're spending more, they want to cut the per capita price and go for volume.
I think one of the advantages for us being a private company is that we are able to manage our pricing relative to each market that we enter. And we're not looking at China as basically the panacea for the financial problems in other markets and for the shareholder markets. What we're looking at is a long-term investment. We've got a 5-10-year strategy, and that's how we see China, and that's how we see pricing in these markets. Is very much about look at the local, regional needs and developments and develop your pricing strategy around that.
Barry, we'll have to leave it. Thank you very much for coming onto the show today to talk to us about your strategy. Barry Thomas, VP and Director of Asia Pacific at Cook Medical.